Today, state lawmakers and healthcare leaders met for a roundtable in Macon to talk about excessive medical lawsuits.
Some lawmakers believe state law has increased insurance policies and made it difficult to practice medicine in Georgia. They're worried the lawsuits have negatively impacted quality of care and have increased healthcare costs. Jasmine Lee spoke with a state senator who talked about the challenges from an insurance perspective.
I'm here outside of the Atrium Health in Macon, where today dozens of healthcare workers explained to Governor Kemp the price the industry is paying for excessive litigation.
These young doctors are choosing to go into other states.
Many lawmakers and physicians told Governor Kemp today they're worried. They say the healthcare litigation environment in Georgia deters medical practices from coming to the Peach State and students from going into certain professions. Mark Baker with the Houston Clinic describes what he thinks the biggest issues are.
It is the insurance companies, it is the provider, and it is the legal. It's not just one area.
In the past, state lawmakers legislated a cap on certain types of medical malpractice damages, but the Supreme Court ruled that unconstitutional in 2010, which has impacted insurance costs.
We've seen rates go up astronomically in the last couple of years, and availability of insurance become more and more difficult.
State Senator Larry Walker says juries are more inclined to believe the people suing hospitals and practices. State Hospital Association CEO Kaylee Noggle said right now, obstetrics is the medical specialty most likely to be sued in Georgia, and physicians say they're seeing the impacts of that firsthand. That's in part because students don't want to practice it, and it's more costly to support, especially in rural areas.
Some hospitals have had to drop OBGYN services. Some have had to drop just labor and delivery services because of the lack of affordability.
Governor Brian Kemp says he's aware of these issues and hopes the state can help.
Costs are still rising for Georgia families, and some students question whether they should enter the medical field at all.
There are programs across the state that try to keep medical students practicing in Georgia, like through rural pathway programs and by bringing a medical school to the University of Georgia.
Now, Governor Kemp says today was just a start, and he hopes to work with physicians to relieve their concerns. In Macon, Jasmine Lee, 13 WMAZ News.
Doctors and physicians pointed to liability insurance being one of the biggest barriers for OBGYNs.
A typical policy for 1 year for a brand new physician coming into this is $100,000. That's $100,000 out of their pocket. Imagine that on top of a student loan, medical school, trying to start a practice, getting a lease on an office. It's cost prohibitive.
Commissioner John King says this very reason prevents OBGYNs from practicing in Georgia, which reduces access to care. A new report from the March of Dimes says 42% of Georgia's counties are maternal care deserts. That includes Peach, Wilcox, Telfair, Twiggs, and Wilkinson counties. And Georgia already has a high maternal mortality rate. Let's take a closer look. The report says Georgia's maternal mortality is higher than the national average. The March of Dimes gave Georgia an F score in 2023. According to the CDC, between 2018 and 2022, the state's maternal mortality rate was 32 per 100,000 live births. The March of Dimes report notes that despite continuous efforts to expand access to quality maternal care centers, it continues to decline, especially in rural and underserved communities.
The state has poured endless resources into health care in Georgia. On the legislative side, Governor Kemp signed several bills aimed at improving health care in rural parts of the state. One law protects against surprise insurance billing, increases penalties for those who assault health care workers, and requires physicians to test all pregnant women for HIV and syphilis. Another allocates funds for a 3-year pilot program to provide coverage for remote maternal health services, and one law loosens restrictions to make it easier to open new hospitals in the state.